Watch this video if you want to get pregnant with hormonal imbalance. I'm serious, don't skip this video. I know how frustrating it is when your body isn't working the way it should and nobody's giving you clear answers. You've probably heard things like, just relax, it will happen, or you're young, you have time. But here's the truth. If your hormones are out of balance, getting pregnant can feel like trying to bake a cake with the wrong ingredients. Even if you do everything right, your body still isn't responding the way you expect, and that's not your fault. In this video, I'm going to walk you through how to know if you really have a hormonal imbalance, the most common types that affect fertility, what testing to ask for, and what you can start doing today, even before seeing a doctor, to increase your chances of getting pregnant. So let's start with the basics. What exactly is hormonal imbalance? Hormones are chemical messengers. They tell your body when to release an egg, when to build your uterine lining, when to stop, and when to start over. If one hormone is too high or too low, the whole system can be affected. It's like a symphony. One wrong instrument can throw the whole song off. So there are signs you might have a hormonal imbalance, and these signs to look out for include irregular or missing periods, very heavy or very light bleeding, severe premenstrual syndrome or mood swings, acne, especially around the jawline, unwanted hair growth on your chin or your chest, hair thinning or hair loss, trouble sleeping or constant fatigue, unexpected weight gain or difficulty losing weight. These symptoms are your body's way of asking for help, so don't ignore them. Let's talk about the common hormonal imbalances that impact fertility. One of these is polycystic ovarian syndrome, PCOS, one of the most common causes of ovulation issues worldwide. In PCOS, you may have very high levels of androgens. These are male hormones like testosterone, which interferes with your regular ovulation, and it can cause you to be hairy or have male pattern of hair distribution. It can also cause difficult to treat acne. Your ovaries may not release eggs consistently or even at all. And on ultrasound scan, one or both of your ovaries may show too many follicles, like greater than 12 follicles, thereabouts, especially seen around the edges of the ovaries. If you have 2 out of these 3 criteria, then it's most likely PCOS. But can you still get pregnant with PCOS? Yes! Absolutely. But you will likely need to track your ovulation more closely. And sometimes you need help from medications like Clomid, Letrozole, or just lifestyle changes to get your cycles to become regular again. Another cause of hormonal imbalance is thyroid disorders. You can either have hypothyroidism or hyperthyroidism. Your thyroid helps to regulate metabolism, your mood, your energy, and you guessed it, reproduction. So your thyroid gland is usually found in your neck region. Sometimes when you have a thyroid condition, it manifests as a swelling on your neck, but not all thyroid conditions present with this symptom. So even a mild thyroid imbalance can interfere with ovulation or increase the risk of miscarriage. So if you're feeling unusually tired, cold all the time, gaining weight without explanation, or losing hair, just get your thyroid tested. Like, it's a simple blood test. Another thing is high prolactin, called hyperprolactinemia. Prolactin is the hormone that is responsible for milk production. When it's too high, it can suppress ovulation, even if you're not breastfeeding. Some women with high prolactin, they don't even realize it. They just notice their periods getting farther and farther apart. Another one is, and the last one I'll be talking about today, is luteal phase defect or low progesterone. After you ovulate, your body produces progesterone to support a potential pregnancy. So if progesterone is too low, the uterine lining may not be ideal for implantation, or it may shed too soon. So some women experience spotting just before their period starts, or have trouble maintaining early pregnancy. So when you have a hormonal imbalance or when you're suspecting hormonal imbalance, what test should you ask for? You don't need to guess. These are common lab tests your doctors can check. FSH, LH, estradiol, these are done on day 2 or 3 of your cycle. The higher the FSH, it means that you have low ovarian reserve. Then AMH, anti-Mullerian hormone, it gives a rough estimate of your remaining egg supply or of your egg supply. It's not perfect, but it gives you a picture. And then you can do TSH or free T4, that's your thyroid stimulating hormone. This is to check if your thyroid is functioning well. Remember what I said about the thyroid and how it affects reproduction. Another test is prolactin test. You want to check if it's high. And then the total and free testosterone, which is the male hormone, and also DHEAS. And the last test I'll be talking about today is progesterone. Progesterone is typically done 7 days before your next cycle, which is often around day 21 of a 28-day cycle. This confirms whether you're ovulating and producing enough progesterone to support implantation. All these tests will give us a good starting point for understanding what your body is doing or not doing. So what can you start doing now to support your hormones? 1. Balance your blood sugar. Even if you don't have diabetes, unstable blood sugar can wreak havoc on your hormones. Eat regular meals, include protein, fat, and limit added sugar. Skipping meals or over-relying on carbs can trigger more insulin release, which affects ovulation, especially in PCOS. Support your stress response. Your body doesn't know the difference between emotional stress and physical danger. Chronic stress raises cortisol, which can suppress ovulation. You don't need to quit your job and move to a beach. Just find something that grounds you daily, whether it's a 10-minute walk, journaling, prayer, stretching, or even just breathing deeply on purpose. Sleep. Aim for 7 to 8 hours a night. I know, easier said than done, right? But sleep is when your hormones reset. If you're sleeping less than 6 hours a night regularly, your fertility will take a hit. Reduce environmental toxins. Some everyday products contain hormone disrupting chemicals. Start small. Switch to fragrance-free or phthalate-free products when you can. Avoid microwaving plastic containers and wash fruits and vegetables thoroughly. When should you see a doctor? 1. If your periods are consistently irregular or missing. 2. If you've been trying for 6 months or more with irregular cycles. 3. If you're over 36 years old and trying for more than 6 months. 4. If you have any symptoms we talked about and you just feel something is off, you don't need to wait until it gets worse. The earlier we catch and treat a hormonal imbalance, the easier it usually is to get things back on track. So getting pregnant with a hormonal imbalance is absolutely possible, but it requires the right strategy. You don't need to be perfect. You just need to understand what's happening in your body and take one small step at a time to support it. If this video has helped you, drop a heart emoji in the comment section below and tell me where you are watching from, and if you've been diagnosed with any of these conditions I mentioned, let me know. I'll be creating more videos that go deeper into each one. Don't forget to subscribe so you don't miss the next video. Your hormones aren't broken. They're just asking for balance, and I'm here to help you find it. Thanks for watching and see you in my next video.